when I heard that word lymphoma, it was like the word of leukemia. It's a very scary word. The impact to me, like so many other folks that get that diagnosis, they look at it all of a sudden as the person that has it, whereas before they were looking at other people that had it. But it's a tough time when that diagnosis comes for you. Next visit in August, he would say, okay, you're beginning to relapse. We're going to have to start looking at other options. I must say that that would be a disappointment. It would be a downer. But I think after kind of having a little pity party, I would begin also to look at the bright side, that there are other treatments that have a lot of promise, newer drugs that have been developed. So I got Rituxan and Revlimid, and we stayed, and I was getting the Rituxan IV every week. So we stayed there locally, and we were going back every week to get another infusion. This stretched out for about a month, but at the 3-month mark from the time we started, the doctor said it's time to do a CAT scan and see if this is working. And so the results came back, and we sat down with him, and that was in April of 2014, and he said, okay, what we're seeing is no difference. And I said, well, that's good, isn't it? I mean, they haven't grown. Here I am, the guy with the glass half full of water. And he said, no, that means we need to try something else. And so he said, there's a new drug that was just approved by the FDA, but it's approved for second-line therapy. Well, I had failed Revlimid and Rituxan, so I was ready for second-line therapy. And so we began with, again, repeating the Rituxan every week and then stretching it to every month and taking the ibrutinib every day. So that's how that all started in April of 2014.
The fact that you had ibrutinib at the time recently approved as an option changed the game for you, it sounds like, right? Can you bring us back to that moment of, first of all, realizing that was an option, and also that this would be a pill? Just sort of the impact, what does that mean in terms of being able to take a pill at home instead of going in to have to go to a center or healthcare center or hospital clinic for an infusion or an injection?
Of course, I started well for the first line. I had a pill as well and the infusion, but knowing I didn't have to go in and to get an infusion once we got the infusions behind us, that was so, your life was much more normal than it would be with every week or every month having to go in and get IVs. And of course, every time you had to go get an IV, you had to have a blood count to go with it. Be sure that your counts were up high enough to proceed with that. You know, when I started on ibrutinib in April of 2014, I think even my doctor, you know, he was cautious too, because all he had to read was the clinical trials and from a medical standpoint, but he didn't know how long it was going to work. So I was going back every month to get the infusion, but I also was having blood work done, and of course that led us to that 3-month point when the CAT scan showed that wasn't working. And so even after we proceeded forward with ibrutinib, I was still getting a CAT scan every 3 months, because with SLL the disease was hidden in my body. There were no swollen lymph nodes on my neck to observe. It was lymph nodes that were internal. So the CAT scan gave an option to see what was going on, and they would look at the CAT scan and compare it to the previous one. So to see whether if anything was changing, did the lymph nodes decrease in size, and once they had, were they staying at that point? So thankfully, I only have to get that CAT scan once a year now.
I know you weren't part of the clinical trials, but you were on ibrutinib as it was very new in terms of being approved. So what was it like being on something new that was better in the sense that it was more targeted, but also so new, there wasn't a lot of information out there?
No, there wasn't. And so the side effects that I was beginning to feel, I had the achy joints, I had the sore muscles. And 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 at one point my knee hurt so bad I thought that I was going to have a knee transplant. But I said, just hang in there. It's probably just a side effect. But anytime I stood up or anything, it just hurt. And I had that happen a couple of times, but thankfully that pain would just vanish after about 3 days. Then the next day was almost like a memory. And if I didn't remember it, I didn't even know it had happened. But then after some period of time, I began to notice my nails were splitting. I had to be careful when I was prying anything with my fingernails that I would pull a nail loose or split a nail. And so then I began to keep my nails much shorter and to file them if they got rough edges and things like that. And that's still an issue. My hair which was so straight and normal in my perspective, became frizzy and wild. And my wife just finally said, just cut it all off. And so that's what we did. There's some hair up there, not a whole lot of it, but if I had it growing out, I would look like the guy, Albert Einstein. I would look like those pictures of him where they had the wild and crazy hair. So that's kind of how it evolved. But having those side effects, you find yourself comparing with other people through the different forums, encouraging other people. And for some folks, the side effects are so overwhelming, they just can't go on. They have to change to a different treatment. The first dangerous side effect that I had was picked up at the 3-month point when I went in for blood work. My neutrophils were down, I think, around 600 or so. And the neutrophils are like the number one fighter in your immune system. And they get low, you can get an infection that's bad enough. So you have to be really careful and unfortunately for me, the doctor said, okay, we've got something we'll try with this. We're going to give you a Neupogen injection. And oh boy, here's another shot. You get as a cancer patient, you've been stuck every which way but loose. So I said, well, here's another one. I said, well, this one goes in your stomach. Okay. He said, it's just a subcutaneous. It doesn't go very deep, and it's a little bitty needle, so just a little sting. So it was easy enough that they gave me one there, and then my wife was able to give me the next two, and by then my neutrophils were beginning to climb back up. So fortunately, that I was able to rebound. But some folks don't. Some folks have a harder time with that. So some folks have to have infusions if their platelets get too low or various blood components. So that was you just have to be careful when neutrophils get low. You have to be careful about being around people. You have to be careful about eating food that hadn't been cooked. So that was just another one of the side effects that you have. Some folks have rashes, and I have some rashes, but I don't know if they're caused by the SLL, or if they're caused by the treatment I'm on, or they're caused by something else. Realizing that with the treatment I'm on, the cancer is not gone. I still have some of the side effects of the cancer. I still have night sweats every once in a while. They're not real bad, but they looked in my blood at MD Anderson, and they said that I have 1.6 cancer cells at a flow cytometry test. So that's like 1.6 in 10,000. So that means it's still there. You take me off of the ibrutinib and it'll come back. So you just keep on taking that pill a day.
I was going to ask about that. I know you said the CT scan is now yearly. to check the lymph nodes, the pulmonary fibrosis, the kidney cysts that have been sort of an issue. But the blood test, the blood work, how often are you getting this done?
I get blood work course done twice a year at MD Anderson on a 6-month interval, but my doctor, MD Anderson, has asked that I also get intermediate blood work done at the 3-month and the 9-month marks. So I do that through my local primary care physician. You did bring up the kidney cyst, and he referred me to a pulmonologist there who reviewed the CAT scan and so forth, and they said I could follow that locally, which I see a urologist once a year here and take them the CAT scan. And the pulmonary issue is something that new has come up in the last 4 years, and it's but they saw it back in 2013 on those early CAT scans, some issues in the lungs. I'm a non-smoker. As it moved forward, the pulmonologist told me that it's idiopathic. That means they don't know what caused it. Idiopathic pulmonary fibrosis. But anyway, we just tracked that, and I hope it doesn't take me out eventually. But you just go with what you got. Of course, that's one of those things. I went back to the doctor at MD Anderson that said, "Is there anything in the side effects of this drug that would point to this being the cause of this?" And that's, I think, the question anybody would ask is and of course, I would look on the internet and try to see if I could find anything in my layman's understanding that would point to that. And I do that usually every year before or every 6 months before I go back to MD Anderson, see if there's anything there that we need to talk about. Because I realize he's got a plate full of patients besides me, but you got to ring your own bell when you're there and bring up the questions you have.
I love that message, and I want to highlight that in just a second. The kidney cysts and the pulmonary fibrosis. So to your doctor's knowledge, it's not related to the SLL.
No, it's not. And apparently, the kidney cyst is not that uncommon, according to the pulmonologist or to the urologist, and even my cancer doctor said any issues from that cyst it will not bother you in your lifetime. Of course, then if you look at that from a negative way, what does he mean by my lifetime? Does he know something I don't know? But yeah, they just there's always a comment on that report every time I have it done about what's happening in both areas.
But I really love, Lynn, how you talked about don't be afraid to ring your own bell, because doctors, no matter where they are, unfortunately, are inundated and overwhelmed most times with so many patients, so many different cases they're monitoring. And the only people who can truly look out for yourself is you, right?
That's right. And of course, certainly your doctor is the medical expert, but he needs to, you really need a doctor that can explain to you and your understanding what's going on. There are things that concern us. And, if you and your doctor differ about the route you're going to go in the treatment, I know for some folks, you change doctors. I have not been to that point. I'm comfortable with my doctor. He's probably in his late 60s now. So I know he's got a lot of experience in treating different cancers. And as a specialist, he treats more SLL patients than anybody else I might go to in the Southwest. So I trust his judgment. But like you say, with new drugs, there's new side effects and issues you're dealing with. And I'll just backtrack here a little bit. We had the experience with our son back in '74 that when you had a side effect or you had an issue, something that your local doctors would say, we found that when we got to MD Anderson to review what we had heard, we found out that they were the experts. They understood what was going on in a much better way than what our local doctors. And I believe that's still true today, just by the fact that your doctor and a specialist, usually in those are in some type of teaching facility like MD Anderson, they treat a much greater number of patients. So their experience pool they have with patients with this type of problem that you're experiencing, they can not only have that experience of their own, they can also question other doctors. in their facility that are treating similar patients to see, are you seeing this? And of course, in my case with a pulmonologist, he referred me to a pulmonologist there locally at MD Anderson that I could talk to about what was going on. And so she was used to dealing with cancer patients and the issues that they had that related to your lungs.
I am so glad that you're bringing this up. Now we can talk about, thank you. You were very open in sharing about your previous experience with your own son, diagnosed at just 3 years old back in the 70s with an undifferentiated lymphoma. And of course, information back then was very different. But from that story of what he had gone through, if you could summarize what that experience was and the impact that it had on you and your wife in terms of how you chose how to deal with your SLL.
Well, we certainly became advocates for anybody that had cancer to go see a specialist. If there's any hope, it's going to be from a specialist, and not only their knowledge, but they'll know what the latest treatments are. Often a doctor in a remote area may not be up to date on what has evolved in the last even 6 months or 12 months. There are doctors that meet at these national and international conferences, and they review the results of the clinical trials and what they're seeing. So it's from our perspective that with our own son, that we would definitely encourage anybody dealing with any kind of disease to go to where the specialists are. And at one point, my doctor at MD Anderson said, "You seem to be doing well. If you want to go back in the care of a local oncologist, you can." And I said, "No, I want to stay with you." In my mind, we laughed about it later. I said, "We're not dealing with a common cold." So, but to be fair about it, it probably wouldn't be a bad idea for me to have a local oncologist in a supporting role, to still let the doctor in MD Anderson be the driving force. And I think that's probably a wise thing. I haven't done it, but as you get older and it's harder for you to travel distances, but as time's gone by, I'm aware of some other doctors. There's a Dr. Awan over at the Southwest Medical Center in Dallas who is well thought of. So that would be an option for me. But MD Anderson, there's probably a half a dozen or more doctors there that if my doctor decided to retire, they could just step in and pick up without skipping a beat.
No, Dad, Dr. Awan, we've worked with him over at UT Southwestern is great, and have heard great things from patients too about how he is with them. So Lynn, going back to your son and your own experience, I think the highlight in terms of just talking about going to see a specialist is he had been diagnosed initially by the local doctors as having asthma, right? And having other things, but actually figuring out going to MD Anderson is when they realized what the real diagnosis was.
Well, the diagnosis of asthma actually came 15 years later, but he was 3.5 years old, and we were with some friends at a swimming party, and we noticed that his stomach was very swollen, like a malnourished child. We said, "What is going on?" And so we went to his pediatrician the following Monday, and of course the doctor was very wise and an older doctor. He knew this was a bad thing, and so that went from there to him being in the hospital locally there where we lived in Corpus Christi. He was there for a week, and finally they were running various tests, and finally there was no CAT scans back then, so it was just blood work, maybe some type of sonogram or something like that, but no CAT scans. And finally the doctor, his pediatrician, told those doctors, "You've got to step up. This kid is getting worse and worse." And so at that point they did exploratory surgery and opened up his abdomen and found a massive tumor in there. And of course they took biopsies and so forth, and then gave us the name of a local oncologist. We said, "We want to go to MD Anderson." Well, we found when we got to MD Anderson, for some reason, we don't know why, that the biopsies were not usable. And so that's why the undifferentiated was the diagnosis in MD Anderson. The doctor had, in fact, at MD Anderson said we hope this might be a Burkitt's tumor, which was a tumor found in children in Africa. But anyway, so it never was for sure what that was. But because of our experience, and he went through treatment, went through a relapse, and we had him for 28 more years. And we were so blessed to have him for those 28 more years. And the cancer in the end did not come back, but actually he passed away because of the damage of one of the drugs. He was, like I say, like 3.5 years old, and one of the drugs damaged his lungs and eventually his heart. And so, but we even to this day, somebody has a child with some type of cancer, we would say, go to MD Anderson if at all you can, or go to UT Southwestern, go to one of the places where they have the experts. You can keep your doctor locally as a part of your team, but it's important that you, and we went through this with my brother-in-law. He was diagnosed with pancreatic cancer, and we said, we'll take you to MD Anderson if you'd like to go. And so we did make several trips with him. It's a very difficult cancer to treat, and he lasted 9 months. So, but you got to try. You got to look at all your options, and
Yeah, I like also, just the message of getting a second opinion, even if you're, so your first one's the local place, community care. To your point, Lynn, they don't have they're not specializing in one thing. They're probably very smart people, but they've got to cover a lot of other things too, versus a specialist who's going to know what's the latest for that particular disease. So in your case, SLL or CLL. What was the emotional, I guess, and mental impact of having gone through cancer as a caregiver, as a parent, having seen your son go through all that, not just about seeing a specialist, but just in general, the impact of having that and then getting diagnosed yourself?
we all, when that cancer diagnosis comes, I think we all look at it from our own perspective, looking backwards at people we've known. And so often people that we've lost, people that passed away from cancer. And so I knew there was hope with some types of cancer. I knew that they were beginning to cure some types. But I just, when I heard that word lymphoma, it was like the word of leukemia. It's a very scary word. So yeah, the impact to me, like so many other folks that get that diagnosis, they look at it all of a sudden as the person that has it, whereas before they were looking at other people that had it. But they remember that experience and what happened and what worked or didn't work. And so, yeah, it's a tough time when that diagnosis comes for you. And even with CLL, SLL diagnosis, if the doctor were to say in my next visit in August, he would say, okay, you're beginning to relapse. We're going to have to start looking at other options. I must say that that would be a disappointment. It would be a downer. But I think after kind of having a little pity party, I would begin also to look at the bright side, that there are other treatments that have a lot of promise, newer drugs that have been developed, drugs that are being given in combination that for some folks are at least getting them so deep in remission the disease is not detectable and questionable whether it'll ever come back. And then there's a CAR T that Dr. Brian Kaufman had, and Deborah Sims down in Australia had that as well, both doing very well. Not always a cure, not always even a remission, but still there's options. So you take them as they come. And one of the things I know a lot of people worry about, watch and wait, that the time is going by, I need to treat this. But this particular drug, a particular disease, a chronic cancer or lymphoma, it just depends at how you're feeling at that time and what your blood counts are doing and what other risk you have, because they often will watch and wait. And each year that goes by means newer drugs are being developed, new experiences, new clinical trials are progressing. So that means for you, if you're not being treated today, but your treatment's another year or two or three or four or five down the road, there may be new treatments or new combinations that were not even thought about when you were diagnosed. So, and even for me, ibrutinib has bought me 8 years. So there are other drugs that have come along and have been proven to be helpful that like venetoclax that would be an option for me at that point.
And I wanted to ask about that. You have had ibrutinib for 8 years. Have you ever thought about getting to the point of UMRD, undetectable, minimal residual disease, just to figure out what your options are? Have you thought about that, or are you okay, sort of like continuing on this until something shows up, the numbers spike or something like that?
Yes, I have looked at the other options and have questioned the doctors about it. And we even had a clinical trial nurse from MD Anderson join us on one of the CL Society monthly calls and talked about the clinical trials that might be an option to add another drug to in my case where I've been getting ibrutinib. But one of the things that all of us eventually bring into this mix is our comorbidities. And so I mentioned that the issue of the pulmonary fibrosis, that makes it perhaps difficult to qualify for a clinical trial. Another issue I have is I'm on a blood thinner because I've developed blood clots before I was diagnosed with cancer. I had two occasions where I had blood clots and found out that I've got an issue with a genetic issue with my blood that makes it more likely that this could happen. Not real common, but so anyway, those two things, the lungs and the being on a blood thinner, would make it more difficult for me to be approved for an additional drug. My doctor kind of took a risk, and I did too, when he put me on ibrutinib back in 2014. A lot of those patients would not be put on ibrutinib because of the if they were on a blood thinner too, because one of the side effects of ibrutinib is bleeding in the brain, subdural hematoma. And so I've told my wife, if I fall and hit my head, no matter what I say, put me in the car and take me to the emergency room. I need to have a CAT scan. So, bleeding like that could certainly happen, even if I wasn't on ibrutinib.
You've been living now with SLL for at least 8 years. I know the doctors had said you probably have had this, for 5 or so years before you even got the diagnosis. But for people who are watching, reading your story, maybe they're more new on this experience, maybe a little bit nervous about dealing with a chronic cancer. What have you learned? And what would your message be to folks out there about how you've been able to live as successfully and well as possible, I think, with this disease for so long?
I would say certainly be open to going to a specialist because it made the difference for me in getting the latest treatment that was available. If I had stayed here, the doctor was going to give me R-CHOP, which is not the right treatment at all. You won't find that as a treatment. And my doctor at MD Anderson said that hasn't been given for years. And so by being at MD Anderson, and I was at the right place to begin on the drug of ibrutinib. And now they know that ibrutinib outperforms FCR, which was the long-time gold standard for this type of cancer. And for some folks, it appears to have been a cure on FCR. But anyway, that to me was, I would say that it's important to get to a specialist. And I think the other thing I would say is find yourself a community of other people dealing with cancer. You can find groups on Facebook. I have a group that I joined, Blood Cancer Uncensored, on a weekly conference call. We're friends that get together and talk for about an hour and a half when we can make it. And it just warms my heart to be able to talk to people and to be concerned with others about the things they're dealing with. And because we have not only CLL, SLL, we have other types of cancer. But likewise, CLL Society, I joined with a group out of the Dallas-Fort Worth area on a monthly basis. And We talk about people give an update on what's going on with their cancer. If you want to talk, you can talk. If you want to, don't want to really say anything, you can do that as well. I've also joined with another group called ANCAN, headed up by Michelle Nadine Baker, that the good group, and so it's a give and take, and lots of times folks will say, "Let me give you a internet link that you might want to follow. There's a study here that might be of interest to you." Or one thing I like to try to help people with is finding a doctor. When it's one thing to say, I recommend a specialist. Well, where would I find a specialist? Well, you can go on the CLL, the Starter CLL Society website, and they've got a list of doctors there by the states that are specialists in this area. And likewise, with whatever type of cancer you might be dealing with. And the specialists are going to be at, like I said, at the university teaching facilities. That's also going to be the place where you can get research. The community doctor cannot put you on a clinical trial because it's not available through that location. You'll need to go to the specialist to see what trials might be available. So I would encourage you to, and things you may have a pity party. Things may be dark, but I really think that you get to talk to a specialist and things will get brighter.